If you are over 60, there is one category of warning signs that is often misunderstood: cancer. Not as a sudden, dramatic event, but as a slow pattern that the body signals long before diagnosis. Many people imagine cancer as something that arrives suddenly, but in reality, the earliest signs are usually subtle. They are changes that seem easy to explain away. Today you will hear 7 patterns that older adults cannot ignore, because the body often sends small signals first. As we age, cells accumulate small errors. Hormones shift. Repair mechanisms slow. Inflammation leaves more lasting fingerprints, and immune surveillance becomes less precise. That combination allows silent changes to mature for years before anyone recognizes that something has been growing. This is why early detection matters for seniors. Long before a diagnosis, there are functional clues. And those clues often come from day-to-day patterns that feel small and explainable. But they are not trivial. The same biological logic appears again and again. Cancer cells do not emerge overnight. They evolve, they accumulate advantages. They grow behind the ordinary routines of life, which is why the small changes that persist without a clear cause should never be ignored. For example, take the form of persistent cough and shortness of breath that does not behave like an infection. This pattern is often an early signal of lung cancer in older adults. The lungs can become irritated by tumors long before breathing becomes dramatically limited, and this irritation produces small persistent shifts. Cough that does not clear. A faint metallic taste or subtle chest discomfort when inhaling deeply. It is not the severity that matters in early signals. It is the persistence without a normal cause. A different but equally important pattern shows up in the digestive tract. When bowel habits change and do not normalize again, this is often the first signal of colorectal cancer. A pattern of irregular bowel rhythm, blood in the stool, or chronic abdominal pressure, or bloating that settles and returns again. These are not occasional variations. They are recurrent patterns. And recurrence is the signal. Breast tissue can also present a quiet change long before anything is visibly obvious. In older women, small new areas of firmness inside the breast or near the armpit, or subtle changes of texture. These can be the earliest functional expression of breast cancer. They do not need to be painful. They do not need to be large. A persistent change in contour or density is already a flag. And time matters, because breast tissue in postmenopausal women behaves differently than in younger women, and new change stands out more clearly than many people realize. In men, subtle urinary flow changes can be the earliest sign that the prostate is not functioning normally. Prostate cancer often begins with slight hesitation when starting urination, or a weaker stream, or the need to urinate more frequently at night. These shifts are small, and men often rationalize them as age or hydration, but slow, persistent urinary changes without infection should always be taken seriously. There is also the matter of the skin, because the skin is the body's historical record of exposure. Sunlight, damage, repair, and redamage. So for older adults, new or evolving skin patches, new rough areas that do not heal, or new asymmetric darkening in a mole. These can be the earliest functional markers of skin cancer. Especially melanoma, the pattern is not pain. The pattern is evolution over time. A different internal signal is blood in the urine, especially when there is no pain. This is a classic early pattern in bladder cancer, and one of the most commonly ignored. Small amounts of blood in the urine can appear and vanish again, and people often dismiss this because it disappears just as quickly. But transient resolution does not mean the source is gone. It only means the bleeding paused. And there is a more quiet and hidden form that often presents late. The pancreas, because pancreatic cancer often signals in indirect ways. New onset blood sugar problems, upper abdominal discomfort that spreads toward the back, or unexplained weight loss without change in diet. These are slow patterns, And because they are nonspecific, they are often misattributed. But when several of these appear together, the signal must be taken seriously. One reason so many early cancer signals are missed is that they can come and go. Small bleeding events, small metabolic disruptions, small tissue changes that do not remain constant. People often assume that if something stopped, then it must not matter. But short-lived does not mean irrelevant. And returning to baseline does not erase the cause. The essential takeaway is simple. The earliest cancer signals in seniors often look subtle. They are not dramatic. They appear as persistent change, small but steady deviation from your normal pattern. The body signals through inconsistency, through shifts that do not fully resolve, and through new patterns that remain unexplained. Understanding this principle allows you to act earlier and to recognize when the body is communicating risk. Awareness does not replace professional evaluation. Awareness guides timing. Because the distance between early recognition and late recognition is often the difference between manageable treatment and far more limited options. Your body is always trying to tell you what is happening internally. When something new persists, pay attention. When a pattern changes and does not return to normal, take it seriously, because every small signal is a piece of information. And information is what allows early action. And early action is what preserves the most options. Another factor that complicates early detection in older adults is that the body's signaling system becomes quieter with age. Inflammation rises more slowly, pain becomes less sharp, and many organs adjust to dysfunction in ways that hide the degree of change. This means that conditions capable of progressing quietly often present with symptoms that feel mild, delayed, or intermittent. For example, metabolic changes linked to early pancreatic or colorectal cancer may first appear as small appetite shifts, brief episodes of fatigue, or mild digestive irregularities. In younger adults, these symptoms are usually sharper and more immediate, but in seniors, the body compensates longer before it fails, which creates a false sense of stability. This is why persistent, low-intensity symptoms carry more diagnostic weight after 60. It is not the intensity that matters, it is the pattern. And recognizing these subtle patterns early gives older adults a far greater chance of acting before any condition becomes advanced. People often rationalize these small shifts as routine aging. They assume a cough is seasonal. They assume bowel changes are diet. They assume urinary changes are dehydration. They assume skin changes are just dryness or irritation. This is how early cancer signals get normalized. Symptoms get reinterpreted as harmless variation. But rationalizing a pattern does not change its source, and the body does not generate persistent new symptoms without a reason.